So I mean, we created Venturi. It was born out of an idea probably about 3 or 4 years ago. We were sat down, frustrated at the backlog of NHS work, and it all came together of, you know, how can we do this better and how can we offer the patients a better deal? And that was the real sort of foundation of what we're trying to do with Venturi. Over the years, as the idea developed and, you know, as we got sort of more backing and a wider group of us, it sort of matured into this idea in this clinic of Venturi Cardiology. And what we've created here is a real one-stop shop, which is, you know, the patient can come in, have a consultation with a cardiologist, have the routine investigations such as an ECG, such as an ultrasound scan of the heart, echocardiogram, routine blood tests, and then ultimately a CT scan of the heart, either a CT coronary angiogram or a calcium score, all within the same sitting. So to give you an idea of that, on the NHS, perhaps, you know, a patient might have symptoms or whatever, they go to see the general practitioner. The general practitioner then refers into secondary care to see a consultant. Now that time might be 6 to 12 weeks, if not longer, depending on where you live. And then from that, you'll see a consultant cardiologist. Usually on the day, you would have an ECG. The consultant would then refer you on for these tests, of which there was obviously a time period, you know, 6 to 12 weeks. At one point, you know, certain trusts around this region, the waiting time for a CT was in excess of 12 weeks. So what we're offering here at Venturi is all that in the space of an hour and a half. To give you an idea, that time period on the NHS could be up to 6 months. And that's got important implications for patients, that, you know, for as much as they get the answer on the day. So all that stress of waiting for what does my test show, what's the test going to involve, that's just eradicated. And importantly, we're able to make treatment decisions on the day, a diagnosis on the day and a treatment decision on the day, which on the NHS, you have the test, you all that time period waiting. As I said before, it might be 6 months before you've got a diagnosis and management plan. And then what we're hoping to do is it goes beyond just diagnosis and management. We're looking to work with our patients in the longer term as well. And that's going to be involve, you know, bringing patients back for regular consultations to see how they're doing, to see whether they're meeting their health targets. And that's not just statin prescriptions and, you know, things like aspirin. It's whether or not they're coping with the dietary recommendations that we've made, the exercise recommendations, and then feeding back on specific key health metrics such as markers of lipids in the blood tests, markers of sugar in the blood as well. So it's all of those things, and that accountability that a patient, you know, that a patient has an accountability. They've got to come back and not explain themselves, but they've got to come back and, you know, have another assessment at, you know, perhaps 3 or 6 months. And that feedback that people get is a real powerful mediator for change. And that's how we hope to sustain, you know, meaningful change in the long term. And that is absolutely key to reducing people's long-term risk.